So what causes arthritis? What's the bottom line? Now today we're going to be talking about osteoarthritis. And remember, there's a lot of different types of arthritis. Rheumatoid arthritis, psoriatic arthritis. Those are autoimmune arthritises, and in a later edition we'll discuss those and what the causes behind those. But today we're going to discuss osteoarthritis as outlined by Dr. Lee A. Hadley, MD, radiologist. You could look at his textbook and notice his 4 phases of degeneration. Phase 1, Phase 2, Phase 3, Phase 4. And notice, if you will, remember the spine should be perfectly straight from the front, but have a big C-shaped curve from the side. Well, whenever we lose this curvature in our neck, or increase the curvature in our mid-back, or increase or decrease, as the case may be, from sitting behind a desk, a computer, slumping on a sofa, decrease the curvature in our lower back. So remember, this would be the small of our back right here. We stretch the spinal cord. So as we stretch the spinal cord, one of the things that happens, get on there, you. One of the things that happens is, if we think of this rubber band as our spinal cord, when we have that forward head posture, or that slumpy, kyphotic mid-back, or as I mentioned, that decreased or decreased low back, right? What happens is, as we lose that curvature, we stretch the spinal cord. What happens then is huge, because that causes the brain to mobilize osteoblasts. And osteoblasts are cells, are bone cells, that lay down bone, like a cast, if you will, like cement, to immobilize the spine, to immobilize that area, so the bones, watch, can't go further and further and further out of place. And that's what we're seeing. That's what we're seeing here on phase 1, 2, 3, and 4. We're seeing, look at C4, 5, and then look at C4, 5 here. What do you see? You see this ratty, pointed bone degeneration, don't you? Well, that's actually, and ironically, the brain mobilizing osteoblasts to lay down bone, to immobilize that spine so the spine can't keep going further and further out of place and cause more damage to the spinal cord. And then you look at phase 3, and then you look at phase 4, and it just keeps getting worse and worse and worse. The problem is, phase 3 and 4, there's hardly any place for the nerve to come out. And we can see that in these little models here, phase 1, 2, and 3, right? Notice how tiny the nerve gets here. So imagine that nerve going to your thyroid, or your heart, or your lungs, or your shoulders, arms, and hands. Do you think you might have some numbness or some tingling? Now, how do we know if we have some of this degeneration going on? Well, think of this. How often have we moved our head and neck around, and just for a second, just a little second, we'll hear a little bit of grinding or sand in there. What do you think that is? That is this degeneration, the osteoblastic activity. Now, through special techniques at our office, 1% of chiropractors approximately have been trained postdoctorally to actually make permanent changes, structural changes that move more towards making a permanent change in the spine. And as we have that change and the spine comes back over, our head comes back over our shoulders, our neck is back over our shoulders, when that happens, now what happens is the brain starts to mobilize osteoclastic activity, which are bone cells that actually, like Pac-Man, come in and eat away all these spurs that we call, that osteoblast created to cement. So they kind of de-cement the spine, they remodel. So we think of osteoclasts as remodelers. And by going through the procedures at our office, the rehabilitative procedures, to get this curvature to come back, to decrease this kyphotic curve, this big thoracic curve, or to increase or decrease the hips, as the case may be, we mobilize this osteoclastic activity, and as you can see in this patient right here, look at his neck. Look at the fifth cervical vertebra, how pointed, especially this middle spur is, and this lower spur. He had searing pain down his arm when he came in to see us. Look at the fourth cervical vertebra, one right above it. And you can see here how that nerve, or excuse me, how the spur at the bottom corner is really pointed. And then here he is several months later, after going through rehabilitative care, we moved his spine 20 millimeters, and now osteoclasts get mobilized, and now look how cleaned up the spine is. No more spur at C5 right in the middle. Tiny little spur at C5 at the bottom, and virtually no spur at C4. So that's what you have to look forward to in both good and bad, right? If we allow gravity to keep taking us forward and poor postural habits keep taking us forward, we're going to get more and more osteoblastic activity and more damage to the discs, the nerves, and more symptoms, right? So if you look at the link below, there's 3 instant postural tips for you to start to change your posture and work on. Okay, so I really encourage you, go to that link below, start working on your posture. God bless you, we'll see you in the next episode.